Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
10 ways to love your brain. You know, we're all in the age of over 65, which is when Alzheimer's catches up with people. From 65 on up, the number of people who have Alzheimer's is great. And so they talk about the lifestyle habits that you should adopt in order to decrease the likelihood of Alzheimer's. And actually, none of them are unfamiliar to you because we talk about most of the lifestyle changes every meeting. First one, of course, is to have a regular exercise pattern that engages you no less than 150 minutes a week, which we talk about all the time anyway. The next is reading. I don't know, many of you read a lot, but reading books and taking courses is recommended as a good way to keep your mind going. Then the third thing they list is stop smoking if you smoke. Most of us don't smoke anyway, but it's still interesting that 5% of the American population still smokes. So that's something that they talk about incessantly. And then keep your blood pressure and your blood sugar under control. Those two things contribute significantly towards the development of Alzheimer's. And then if you can avoid, I guess this is the fifth one, avoid head injuries. Of course, that's maybe easier said than done because I guess one of the things you can do is help your children and grandchildren to stay away from football. But they talk about wearing a seatbelt, wearing a helmet, and wearing a helmet when you're riding a bike and all that stuff to prevent falls. And of course, we know that falls are the old men and women's worst enemy because they contribute significantly to old age mortality. And then, of course, number 6 would be have a healthy diet, rich in vegetables and fruits, and low in fat. Something that Darryl's talked about incessantly. And that's something we've talked about almost every meeting. And then recommending getting 7 to 9 hours of sleep every night, which is something we talk about as well. That's easy to say. It's not as easy to do. How many of you get 7 to 9 hours of sleep a night?
I do.
That's 2. 2? Only 2? Wow. That's surprising, but anyway. Darryl, you get 7 to 9, huh? Good, okay.
Yes,
So
sir.
3 out of us.
I get 7 to 9 hours of sleep, but they're not consecutive hours. That's the problem for me. It's like,
Well, we're going to talk about consecutive. They don't say consecutive,
okay,
just
well,
7 to 9 hours a night.
you tell me about consecutive, because I might sleep 3 hours, wake up, go back, sleep another 4 hours, wake up, go back.
Yeah, that's good. That's good. Yeah, that's good.
Okay.
Then number 9 would be stay socially engaged. That is, participate with your community, with churches, group meetings, those kind of things. And a number of you sing, and of course they recommend singing, and those who don't sing, musicians, and they recommend that as a very good way of loving your brain. And then finally, they talk about something that we have mentioned, talk about playing chess and bridge and doing puzzles and those kinds of things. And so those are some of the recommendations they make that aren't novel to us, but anyway, good to remind us of the practices that we should be participating in as we age, as we try to avoid getting what close to 30% of the older population gets, and that is Alzheimer's. Any other comments or questions about those 10 ways to show love to your brain and minimize the likelihoods of Alzheimer's?
Dr. Callender,
Yes.
I believe those things are good. And my thing is this year I've started using my sleep apnea machine every night, and I'm getting 7 to 9 hours of sleep. And if I get less than that, if I get 6 or 5, I still feel better than I used to when I got 12, because the sleep apnea makes me feel better, period. Gives me more energy. Um, I feel so much better this year because of that. I had been trying to use the machine and not using it well, but using it sometime. But I dedicated myself this year to using it every night, and I can tell the difference.
Thank you so much for sharing that. Thanks for sharing. Any other comments?
I also use the CPAP every night, and I even use it if I take a nap. It definitely, for some reason, it clears my sinuses. You know, by the morning, you know, I'm clearer. And as John was suggesting, if I have to wake up, you know, before my 7 or 8 hours, it keeps track of the amount of time that I'm sleeping. It also adds my nap time. All right.
Okay.
Dr.
Any other comments? If not,
Yeah, I have a comment. You know, in my situation, I don't have any signs of sleep apnea, and I don't use a CPAP machine. However, I have a problem with stuffy nose. My nose is always stuffy.
but it doesn't keep you from sleeping, you know?
No, but it's a breathing thing where I don't get nice fresh breath.
Betty,
I have
can you talk yet, Betty? Still?
I have a question. This is Sylvia. Good morning, everyone. I'm
Good morning.
driving up to my mom's. What are the signs of sleep apnea that you might need a machine?
What is your question?
What are the signs that you may need a sleep apnea machine?
If you snore. If you
Just
snore.
snoring in general?
If your partner tells you that you snore, that's a sign that you may need sleep apnea. Now there are many other signs, but that probably is the commonest. And also if you
And
if you wake up and you're tired after sleeping, that
uh-huh.
is also a suggestion that you may need.
So what do you do? Talk to your doctor and say,
You
"Hey,
go
look,
and
I
get a sleep
snore."
test. You talk to your
I
doctor and you set up a sleep test, and they
see.
will follow you as you sleep and watch your oxygen level. And if your
Oh,
oxygen level is low, that means that you have sleep apnea, and CPAP would help you.
I see. Thank you.
It's very important because sleep apnea is thought to be a cause of hypertension and increased death rates, particularly in African Americans. So if you have sleep apnea, treating it by CPAP will lengthen your life, and also, as mentioned here, make you feel stronger and better, and give you more energy, and also lengthen your life. So
One other thing to consider is that on at least on my machine, there's a water tray. I can put the still water in there, and it humidifies the air that I'm breathing. That might be something to help John Tatum.
yeah,
Yeah, thanks for that.
Okay, any other comment? Oh, yeah, John? Any other comment? If not, we'll start the articles.
Darryl, you recording?
Any other comments? Okay, next, it's interesting, these are what they consider the most exciting medical research breakthroughs, and they talk about 3 items actually that are really critical. First is the advancement in mRNA technology, and applying this, of course, brought us the vaccine, but many are not aware of the fact that this technology is now being used to treat tumors. And of course, it's well known that the ultra processed foods are involved in so many diseases, including the development of depression. And then finally, the application of the AI to paralysis, to stroke, and spinal cord injury. And so these are considered by these 5 major research breakthroughs are considered as items for discussion. Then the mRNA application to COVID is something we've been talking about for the last 3 years. And there's little question that that has been a marked contribution. The second part of it, though, is less well known, and that is the fact that these vaccines are used for immunochemotherapy for cancer. And that is, as a consequence, we'll see some more articles later on that point to the fact that the mortality rate for cancer is decreasing. And one of the reasons is related to the new type of chemotherapy, as well as the immunotherapy that has developed. And these cancer fighting agents are making a big difference. So that it may well be that the best is yet to come, but it's still already making a difference in the mortality rate of cancers. However, cancer is still killing, and still the number 2 cause of death in the world. Then, of course, the ultra-processed foods effect on mental health and health in general has been talked about ad nauseum for the last few years, and there's very little question that the impact of ultra-processed foods has been very negative, as it affects all aspects of health, mental health as well as physical health. And then finally, the area that we have been least successful at is dealing with the spinal cord and having people paralyzed because of spinal cord injury. And so groundbreaking research has resulted with AI enabling a man with spinal cord injury able to walk again, which is a little short of miraculous, because we've been totally unable to do anything like that. It's interesting that Marco himself has quadriplegia as a result of a biking accident. And so having that development is a major breakthrough. Of course, that's been very limited. We're talking about 1 or 2 or 3 patients. And then, of course, the neurostimulation to aid stroke recovery. People who have, of course, one of the major problems is to have people who have strokes to go to the hospital right away and have the clots removed, or and have them recover. But now we have deep brain stimulation as well to affect, to allow for the resolution of some hemiparesis that results from stroke. So these documented proof that these therapies are making a difference. And where we will go from here remains to be seen, but those are 5 major research breakthroughs of 2023. Any comments on those 5 breakthroughs, which are remarkable? Okay, this is a negative article in the sense that there's a shift in colorectal cancer to advanced stages and occurring at younger ages than diagnosis. People with advanced stage cancer increased from 50% to 60%, which is very, very bad, because that means that by the time you make the diagnosis, it's difficult to treat, and it's likely to result in the death of patients, even though we've decreased the age at which you need to get colonoscopy and other things like that to 45. Yet colorectal cancer advanced is being diagnosed in younger patients. And so the question is why? And some of it may be related again to the diet. And some may be related to people who are not getting colonoscopy. But more and more, it appears to be related to our diet. The other question is, what else can you do to prevent this from occurring in younger patients? And it is attractive to say that lifestyle changes such as diet changes may go a long way to producing a remedy to this. We've talked about the merits of screening, but this is a shot, a negative shot for screening, because instead of things getting better, things are getting worse. Now, it is true that we have better treatments for cancer once it's diagnosed, but an ounce of prevention is what most of us are more interested in. Any other comments about this disturbing finding?
Dr. Callender, do you think maybe they should have screening more frequent than, well, my father got colon cancer at 90, and he was treated. He had to have he had to have his colon removed. He had a ostomy bag, and he did not die of colon cancer. He was free of cancer. In fact, before he died, they wanted to attach him back, but he didn't want to do that. But what I'm saying is maybe 5 years or 10 years is too long. Maybe they should test people 2 years. My brothers and I have to get tested every 5 years because of our father. But before that, the first couple of years after he died, they had us testing every 2 years. So maybe they have to, instead of saying 10 years or 5 years, maybe they should go to 2 years to test people.
Well, I guess they have to see what the evidence suggests. I think it may well be the case for people who have family histories of cancer, but it's food for thought. It's food for thought. Any other comments or thoughts? Darryl, what do you think the role of ultra-processed foods plays in this?
Huge.
Okay, all right.
Dr. Callender, what are the solutions of the end-stage colorectal cancer? Would one of them, well, like Mariana said, her father had her colon removed. I guess that's one solution. Um, are there, well, surgery, I mean, is there anything else other than removing the colon?
Well, it depends when you find it, and because rectal cancer is often treated by chemotherapy and radiation, whereas the colon cancers are more suitable. But they also treated by chemotherapy as well. But it all depends on the stage at which the cancer is identified. But I think when you have a situation like this where you don't have an answer, you have to look at new ways of treating. But I think Darryl's answer says a lot in terms of looking at the diet and the ultra processed foods and other things. And then, of course, as you mentioned, whether there is merit, whether there is merit to increasing the screening, that has to be looked at as well. I think everything needs to be looked at since we are going backwards rather than forwards. However, the treatment for rectal cancer with chemotherapy and radiation has been very effective, which is a little different from the colonic cancer, which is above the rectum. Well, let's go to the next one. Well, this is an interesting article because it says that we worry about obesity and we got all this medication, surgery, and everything else, and the last thing we look at is the brain, when that may be the first thing we should look at. And this article talks about this 32-year-old person who just couldn't stop eating. And that is often the case with people with obesity. They love food and they just eat and eat and eat and eat. And they have found medications that affect the brain can be helpful in terms of dealing with the way in which the people who weigh 5, 6, 7, 8, and 900 pounds just can't stop eating. Now, we agree that some people, in spite of the fact that they don't eat very much, still gain weight. But they are talking about the people who fit in the category, who just eat and eat and eat, never stop eating. And they talk about this GLP-1 agonist drugs that they give that may curb the appetite, which may go a long way to dealing with this. And the thought is that it's a brain problem, not so much a hormonal problem. And the proof of the pudding will be in the eating, although nowadays bariatric surgery has been used for many people. Because what they're calling this is a food addiction. That's essentially what they're calling it. Just like you have a cocaine addiction and the other addictions. So they think that dealing directly with the brain itself, with the dopamine hypothesis, may be the way it works. But so far, we aren't having a lot of evidence, although there is a lot of schools of thought that have identified that leptin and other compounds in the GI tract impact the brain and result in obesity. So it'll be interesting to see as the year goes on, as they attack the brain the same way they're attacking the GI tract, whether this will result in reduction in the obesity in those people who are addicted to food.
Dr. Callender, that sounds like a great solution to work on the brain, because I think those people who get, well, they say those people who get bariatric surgery risk gaining the weight back if they, if they're not careful. And then I know some people who got their mouth wired shut, almost shut, just open enough to get a straw in. And so once they lose all the weight, they have a chance of gaining the weight back as well. So I think we got someone we're talking about dealing with the brain.
Any other comments about this?
Yeah, we just scrolled past a part that was talking about, go back a little bit. They were talking about people, they had a control group, people, it's right there, people eating ultra processed food and no processed food. And the people ate the same thing. The people on processed food gained weight. People on no processed foods lost weight.
Mm-hmm.
Mark, you had a comment?
Yes, I just in my very casual observation, yeah, I certainly agree with this article. I see another aspect is that I see people using food as a source of comfort. When they've had some psychological trauma in their life, whether childhood or adulthood, something kind of triggered that lifelong yearning for food as a source of comfort. And then I've seen those who use food as they have a scarcity mentality. They may have had like food insecurity growing up or some sort of thing. So anytime they see food now, they psychologically just eat as much as they can, because they have this gnawing notion that they don't know when their next meal is going to come from. So it's kind of like they just kind of subconsciously stock up. That's just my casual observation of how I see people have treated food. But my question to you, Dr. Callender, is what do you think about hypnosis as a form of solution for those who may be suffering psychologically with addiction and such?
I think there's merit to that. Yeah, I think there's a role for hypnosis, which fits into the brain hypothesis. Any other comment on this approach to obesity? We've got all kinds of approaches now.
Dr. Callender,
Yes.
I think I agree with this article. I agree because when I was addicted to nicotine, I could get it out of my bloodstream, but I never was able to stop until I could get it out of my mind. Once it was out of my mind, then I was able to uh, be free. But
How'd you get it out of your mind?
Well, I used that Wellbutrin. The Wellbutrin got it out of my mind. It took it out of my system completely. The nicotine patch, all that did was substitute the cigarette for the nicotine patch. That didn't work. When I would abstain, that would be fine for a while. But if I saw somebody on TV smoking, it made me want to smoke. So until I got it out of my head, that was the key. And it's been 13 years since then. So I think that's a good approach. That's what they need to do. They need to get it out of the addiction has to start with getting it out of your brain.
Any other comments? Interesting article that's very provocative. And okay, let's go to the next one. This is the one that we mentioned before, that when you look back over the last 2 decades, identified that the cancer death rate has dropped by 33%. It's very significant. And in the last 2 years, they've approved 14 new anti-cancer therapeutics. And these will more than likely decrease the cancer death rate even more. So, of course, the biggest causes of death in cancer are the lung cancer and breast cancer. And even though you've had these large declines, you still have so many young Black women who are dying from breast cancer. And it's very distressing. Now we have immunotherapy, which we didn't have before. And we have inhibition cancer therapies that we didn't have before. And so these are all resulting in decreased cancer mortality rates. But we still are having cancer at the top in the top 5 always, and usually number 2. So yeah, we're making progress, but and as you go old, it's one of the diseases that becomes commoner as your immune system weakens. Cancer, the incidence of cancer increases, and that may be why these immunotherapies are becoming more effective. What is interesting is that because of this, even though they're spending billions of dollars for research into cancer, there's a need for even more, especially with the poor results with pancreas cancer, where we've really not made any progress with pancreatic cancer. You can see that 3.5 billion to NIH and 2.6 billion. So we're talking about spending $6 to $7 billion and suggesting we need more. And we talk about spending money for defense, spending money for defensive medicine, and we would be much better off if we spent a lot of money on addressing even more those issues that are causing cancers, like the so-called ultra-processed foods and other things like that, which seem to be perhaps the root cause of the cancers. Well, I say that because we really don't know what is the cause of cancer. We know what contributes to it, but don't really understand all the ways in which pancreatic cancer and brain cancers and other things occur.
I have a question, Dr. Callender. One word that I saw in the last article and one word in this article. The previous one was agonist. Can you help me with that? What is an agonist?
Agonist is something that supports something, and antagonist is something that goes against it. So An agonist is something that supports the growth of something. An antagonist is something that goes against the growth of something.
All right. Yeah, you just answered it for me. I was thinking of antagonist, so it's like the opposite of the antagonist. Okay.
Right.
All right. Thank you. And the glioblastoma.
That's one of the brain tumors that and brain cancer is another area that we don't do very well in. Pancreatic cancer and brain cancer both have very poor 5-year survival rates. And once you make that diagnosis of pancreatic or glioblastoma brain cancer, then death is likely to occur within 5 years, regardless of what we do so far. So these are areas that we have made little to no progress in. So we need to really try to really identify if the ultra processed foods really are the problem and really move aggressively toward, because an ounce of prevention is certainly worth a pound of cure. All the billions of dollars we're spending, and still people are dying from cancer right and left. Of course, one of the greatest tragedies I think of all is to see how nicotine is worldwide such a pathogen, but yet we still make nicotine. It's ironic that we make poisons that kill each other, but don't regulate that. Anyway, any other thoughts about ways in which we should try to overcome this dreadful disease?
Dr. Callender.
Yes.
They have a drug for alcohol. If somebody is addicted to alcohol, they have a medicine that they can take that makes them get sick if they drink alcohol, called antabuse. Do they still use that medication?
Not very much, but they still use it. Not too much.
I guess the problem is that who would want to take a medicine? That's
the problem.
Right.
Yeah, that's the biggest problem.
They need to get something, because processed food tastes so good.
Yeah.
It tastes so good, and so many things that are good for you don't taste good. Maybe they can find a medicine that if we eat processed food, we won't feel good or we'll get sick.
Well, I think one thing is clear. We're not doing enough right now. So any thoughts that you may have certainly may be fruitful. Darryl, you got any thoughts on this subject?
Yeah, just the usual ones, including, we're talking about cancer rates with Black women. And a lot of that has to do with uterine cancer. And they're finding links. Let's see, Boston University, I just put up a search for this. Where'd it go? I lost it. But they do very few large scale studies on Black women. And Boston University just did a study where they say there's a very definite link between hair relaxers and uterine cancer. And of course, Black women are the main users of hair relaxers. And it's really kind of unfortunate because, we do it trying to adhere to a European standard of beauty. which causes us a lot of health problems.
Yeah. Yeah.
So, my call constantly for Black women, stop straightening your hair. There's nothing wrong with nappy hair, having naps in your kitchen, all of those things that your parents, that your mother and your grandmother told you were bad. They lied. Stop listening.
Uh, okay. This is Betty. Did you have a comment? Oh no. Okay.
Can you hear me?
Yeah.
I'm on my cell phone, but I need to turn something down.
The
I don't
computer.
know. Okay. But I don't
Turn it
even
down
see
even
the
more.
sound. I don't even see the sound on here. Wait a minute.
Echo's gone. Aaron's back.
Okay, can you hear me now?
Yes.
Yeah.
Okay. I had wanted to comment about the straightening that Darryl was talking about. I've been using it for so long. I fortunately haven't had any problems with it. And I guess I started using it to maybe make sure I look better, or I thought that was a reason. But at this point in time, I can't get a comb through my hair unless I use it. So it's not necessarily just because I'm trying to look like the Europeans. It's because I'm trying to comb my hair.
Well, guess what? Black hair isn't meant to be combed.
Well,
We do a lot as seniors, as grandparents, granduncles, grandaunts. If we can let go a lot of these things and go back to natural, then our children and our grandchildren will follow us. They say, well, if grandmama can do it, and she's been perming her hair for the last 60 years, if she can do it, I can do it. We need to make a change. It's called
sounds
Save the
good, but
Babies. Save the babies from, don't make them go through what we went through.
Well, Darryl, this generation already has done it without us doing it. That is the style, the natural look. Even if when you look on TV, the curly look and all of that. Our generation had to do it, and as you always were talking about history, the only way that a Black woman could get a job was to straighten her hair. The moment, like in the 70s, when I did have an afro, it was cute for a young adult, but it wasn't in the trend of style. And I remember teaching in the 80s and 90s when we told Black women they could not, and they had laws in certain institutions that you could not wear braids. Now braids are acceptable, and even in Africa, that is the way that women did. They would take time to braid their hair. And even if you look in the Bible, you're talking about braiding hair. So as far as a woman's beauty and adorn her hair, that has always been the thing. But as far as straight hair, now I just got over the point that I could let my gray hair grow out. Next point, I know I'm brainwashed terribly. I'm just used to it, and my comfort level is to have straight hair. But I'm edging and itching toward wearing my hair natural. But it's for a woman, it's still work. So consequently, that's why a lot of women, they get tired of that work. And you even look in Africa, they just shave it off. So that's all I have to say about that.
Well, okay, back to Africa. They get a lot of American TV, and so a lot of their beauty standards are according to what they look at African Americans on TV. And so the way Africans do now is not how they did their hair 100 years ago. And when you talk about we're making very little progress, yeah, we're making a micro amount of progress in how young women are treating their hair. One of my favorite things to do is when I'm downtown Chicago, I can just sit out a restaurant window and watch people pass. In Chicago, probably the women that walk past the window where I'm looking, they're about 40% black, and most of them are about 70% under 40 years old. And I walk past and see how many don't torture their hair. I see all kind of weaves. I see hair pieces, and that's prevalent among under 40. Uh, and yeah, I see some braids. I see some cornrows, but for the most part, I see people not accepting their natural hair and just torturing their hair with just a variety of means where they're not embracing their natural hair, as opposed to when I look at white women passing that same window, then you got about high 90% of them embracing their natural hair. The thing that they do is that you got about 90% of white women blow drying their hair, because without the blow dryer, that stuff would be have no body and it'd be flat and stringy.
Okay.
I have a comment. What's been mentioned before a lot is the media, the visual effect of what you see on the television and in the movies. And I think you've seen it more and more lately. The style of black hair that is more natural. And I think that has a huge role in what's acceptable. As you see more of that the puffy, natural African look on TV and movies, then it'll get more accepted in the African, at least in the African American community.
Yeah, well, a lot of times those styles, they may not be using hair straighteners, but they are putting some sort of chemicals in their hair. It's not just puffy and not. If you just let your hair, don't do anything to it, it's not going to look like it looks when you see them on television.
True.
Okay. Let's go to the next one. This is an article that's very similar to one we had last week, but it shows that they've increased the number of people who need to be screened from 50 to 80 years with a 20-year or greater pack hair history, who now can get the lung scan. Of course, 20 pack year history is a long history, but it's the history that is associated with lung cancer. And this is thought to be an important screening development to get more people to get a diagnosis, earlier diagnosis of lung cancer, since that's one of the commonest cancer-related deaths in this country. It's especially when you see it's more deaths than all the others combined. So it's once again, it's interesting. Yeah, you got a disease that is almost nearly exclusively caused by a poison that we smoke. And not only those who smoke, but those who live with those who smoke. So it goes to show we do cultivate habits that are lethal. And Nicotine is one, alcohol is another. Ultra processed foods apparently are an additional.
Dr. Callender,
And then
can
if
you
that's not
define
enough, we go to eat
pack
cigarettes.
years? What does that mean, pack years?
It means that you smoke 20 packs a day.
Twenty packs a year.
Yeah, 20 packs a year.
That's really not not a lot of cigarettes to smoke 20 packs a year.
That is, well, if you take it up to 24, that would be 2 packs a month. And you break it down, you over smoke.
I used to smoke a pack a day.
Right.
One
I
pack
know
a day, that's 30
I
packs a month.
smoke 1 pack a day, and I know people that used to smoke 2 and 3 packs a day.
So 20 packs a year would be, yeah, about a little less than 1.5, yeah, about 2 packs a month. It's interesting how that all started. As somebody mentioned, and the social media we had was TV and movies. And I mean, they bombarded our community with those cigarettes, smoking Westerns. Every movie, somebody was smoking a cigarette. So it became a
Cool.
habit that everybody seemed to adopt. And it's turned out to be a lethal habit.
Mm-hmm.
I remember reading the Ian Fleming novels. I used to think it was so cool. As soon as I was able to get cigarettes, I was going to smoke because they made it so
Yeah, yeah.
appealing. You know?
Yeah, they did. Yeah. Almost like you had to smoke. Yeah. If you didn't, something's wrong with you.
Really made you cool.
Mm-hmm.
No pun intended.
Yeah, there's a pack of cigarettes called Cool.
This is an interesting article. I just put it here too. This is not something that is available yet, but it's something that down the road will replace perhaps the pancreas transplant, and where they put this device under your skin, and it has insulin. It releases insulin upon demand, and so the whole situation is regulated. Actually, they have something like this already. That I know one of my friends is a diabetic, and he has a device much like that that does all the work for him. So for diabetics, type 1 diabetics at least, the cure is on the way. And of course, there's no disease that's well, cancer is destructive, but second to cancer, diabetes is destructive if it's not under control. When it's controlled, it's okay. Type 1, especially type 2 as well. If it's controlled, you do okay, but if it's not controlled, it is just like cancer.
Dr. Callender, where does the insulin come from?
Pancreas.
No. The insulin in the device.
It's in the device.
Where is it enough in that device to last?
Yeah, and then it can be replaced.
Got to go get a refill.
Yeah, but uses probably replace it every 6 months or so, something like that.
Interesting.
But they do have a device now that's very similar to this. That I know one of my colleagues who has it and keeps his blood sugar under control. And that is what causes the complications, the high glucose levels.
Mark Tatum has his hand up.
Yeah, Mark.
Just on this slight tangent, just looking at the technology of doing implants for treatment. I'm remiss that I came in a little bit late. I wanted to see what, at the beginning of this Zoom call, you all were talking about CPAP machines. And, wanted to kind of provide some of my experience there. But the connection here is that I saw recently that they are having another treatment for sleep apnea is an implant. I don't know if you guys have ever seen or heard that, but they're supposed to be some type of implant that you can put in your chest that can
Inspire.
that can trigger,
Yeah.
trigger the right muscles and such, to try to get your breathing, back regulated and such. But this is just to talk about the technology, the health technology of doing implants to do stuff. When I saw that, I don't know if, for back to the sleep apnea part, I don't know if I trusted it. It seemed too new, but I'm just kind of just commenting on the technology of it all. It seems very innovative, I guess.
Yeah, and I think maybe next week we'll talk about Inspire, because that's a relatively new thing that is implantable as well. But this implantable device is now a modification of it is available already, and it works very much like this, except that I'm not sure how often they replace the device, but they do have a device that's similar to this already for type 1 diabetics. And that's the future, that they will put these implantable devices in, which works even better than an insulin pump. So the cures for diabetes is or effective treatment of diabetes is right around the corner. Just like we talked about the treatment for sickle cell disease with the genetic treatment for sickle cell disease. Remember we talked about last week that 22 out of the 22, when the gene intervention took place, 21 of the 22 had no more than one crisis a year, when they were used to have one crisis every month. So we're making progress in terms of identifying ways in which artificial intelligence can help develop tools at treating many diseases. Any other comments about it? Thank you very much, Mark, for sharing that information, because it's very important to be aware of what's coming down the pike. However, this is old news. COVID's still killing 1,000 Americans per week, and hospitalizations on the rise. And people are not getting the boosters that they're supposed to be getting. I think the last study showed that about 20% of the people who could get COVID shots have gotten them. And this is the end of the first month. January and February are likely to be more lethal. So anybody on this call who's not gotten their RSV and COVID and flu shot, now's the time to get it. %57 of residents said they're not going to get it. The variant is not as problematic if you have the booster. But if you don't have the booster, and the symptoms to me are essentially the same. The only difference is you have more of a sore throat with this than the other one, but the symptoms essentially are the same. And what happens is that now we have 3 vaccines, which we never had before. But the problem is that people aren't taking the vaccines, and that's a concern. The preventive measures are still the same: wearing masks, ventilating rooms, and staying home if you're sick. And then the symptoms, as I say, are still essentially the same, except more often you have sore throat. But I'm happy that most of our audience has already gotten their 3 vaccinations. Go to the next one. If there's is this the last one? But this is an interesting one in that.
There are several more.
Okay, but this is one of the. It's almost 10:30. I thought we'd finish early since we only had 13. But this is a situation where they did some tests and they found that our treatment for the mental health illness, the effort to alleviate psychological suffering with mindfulness and other such techniques. And they thought that this new behavioral therapy would make a difference. And in point of fact, when they used it on the teenagers, while it may have worked on some of the adults, it was ineffective. And as a matter of fact, they found that in teenagers, it made it even worse. So one size did not always fit all. And some things that work for older people don't always work for teenagers. And this is just an example of one situation in which the DBT, which is the therapy they recommended, was ineffective. So I guess the moral of the story, we have to evaluate all of our treatments to make sure that because they work on one group does not mean they will work in all groups. And just points again that teenagers are different from adults, which are different from infants. I think one of the biggest hazards in field of mental health is the stigma of mental health, and I think efforts to eliminate, minimize the stigma will go a long way to helping us deal with one of the commonest ailments that we have, which is mental health ailments. Anxiety, depression, etc.
Dr.
One
Kelly,
of the questions that you might have is how many of our teenagers actually go in for mental health treatments?
it's increasing nowadays. It really is increasing. I don't know if it's because of COVID, pre-COVID, or
Well, COVID certainly has increased the incidence of anxiety and depression.
my question, Dr. Callender, is these mental illnesses, are they generally hard to diagnose and you really need a professional to diagnose these things?
Well, as you may know, they have screens now that are able to pick up depression and anxiety, which they use more than ever before. And they're able to use screening tests, which they recommend now for people under 60. And so the diagnosis is certainly made more easily. Also, people are more willing to take mental treatment, whereas in the past it was a stigma, and people would not go to psychiatrists. So more people are going to psychiatrists now, or psychologists.
I asked that question because I have a relative that has something wrong upstairs, and I can't put my finger on it.
Well, one thing is if they have a problem and they don't get it treated, it can worsen. So recommending that they can get help is worthwhile. Okay. And you have a happy new year, Carol. We'll miss you. And see you next year. Probiotics is a subject that we've talked about, and you can see it. $32 billion is what people spend on probiotics. And remember, this is what is defined as the good bacteria that you put in your GI tract to kill off the bad bacteria. And there have been many studies over time to eliminate diarrhea as a consequence of these probiotics. The question is, do they work? And most of the studies indicate that they are of some benefit. The extent to which they are of benefit and whether you should take them or not still remains to be seen, but there are studies that suggest that they are of benefit.
Pepto-Bismol comes to my mind for diarrhea.
Which is not a probiotic.
Okay, that's what my question. Thank you.
That's not a probiotic. Probiotics are really bacteria, actually, good bacteria that are supposed to kill off the bad bacteria. That's the whole concept of it. But how good they are, and the data suggests that they are a benefit. But and we do know that fecal transplants do work, which is a exaggerated microbiome situation where you take the good bacteria from somebody and give it to somebody who doesn't have these good bacteria, and they kill off the bad bacteria. That's what a fecal transplant is all about.
Mm.
Now, this is important because this is a case in which they forced these people to retire at the age of 75. And the EEOC said that it was against the law. And so they had to pay these people $7 million because they violated the law. So it's against the law to force anybody to retire, although there are professions which this is done routinely. Pilots, and in the field of math, I think they force you to retire at 70 or 75. So that is age discrimination. And these people took it to court and they won. Wow.
And now that they got $7 million, they don't need to go back to work.
Well, that's the total. I mean, I don't, but I guess that was the total, not they weren't getting $7.5 million per person.
Do you know how many doctors were involved in this?
Huh?
How many doctors were involved?
I forgot they have at the top of the article the number of them.
Back when I started working at Allstate in management, and this was in the 70s, we were scared of the EEOC, and we trained new management people that the majority of cases filed by the EEOC would result in success for EEOC's client. And that's all changed. They've taken the teeth out of the EEOC with various laws. And right now, the success rate for EEOC closed workplace discrimination cases is only 17.4%, finding for the client in discrimination. And that can be age, sex, or racial discrimination. As far as, let's see, another statistic is that 63% of employees who filed discrimination complaints, including harassment, later lost their jobs. So, not very successful in winning these cases in district court, but the majority of employees that file them these days lose their jobs. So, it's great that these doctors won an EEOC complaint, but they're in the minority.
I remember
Thanks.
years ago when I was in the Postal Service, the federal government had a law that you had to retire at 70. And it stayed that way for a while. And I don't remember what year they changed it, but that was all federal employees other than the Congress people had to retire at 70.
Yeah, well, I think age discrimination became popular more recently. And that's the law right now. You can't discriminate against somebody because of age.
Yeah.
But there are a number of cases, as you mentioned, places where I think there are a number of professions where people kind of force you to retire. It's going to be interesting to see what impact this will have on anybody else. They passed in 1967. And this is a rare case that double uterus. We talked about the fact that uterine transplants were now being done, and there have been at least some 30 births from uterine transplants. But this is somebody who's born with 2 uteri, which is strange. And she gave birth, and then I don't think this has happened before. Strange. Yeah.
So they aren't considered twins then, right?
Yeah, right. Yeah, strange.
Identical twins.
Well, it didn't say that.
Yeah, I would think fraternal, if anything. Yeah.
Yeah, it would have to be.
Yeah.
Has to be fraternal, right? Yeah.
Separate birthdays.
They had rare separate birthdays. That's interesting.
Yeah.
Yeah. My brother from
Wow.
mother.
That's amazing to have 2 uterus and to have pregnant both of them. Wow, that's weird.
Yeah.
Yeah. Wow, amazing. You can conceive it happens.
I was just wondering if they knew prior that she had 2 wombs. How would they know?
Oh, they can know. It's easy to know now. Nowadays, they do all kinds of ultrasonic tests and genetic tests, so that you know the sex of it long before the child is born.
Well, the other thing, I mean, this article brings up thousands of questions. What about the ovaries and so forth, and which direction the sperm goes, and all that kind of stuff?
Well, there's no mystery. You know, she has two uteruses, so so the sperm goes into each uterus separately.
And two sets of ovaries.
Well, no, there are two sets of uterus. It didn't say two sets of ovaries.
And
I
so
mean, you have two ovaries anyway.
how many menstrual cycles and all that kind of stuff?
Well, well, you would have to have a menstrual cycle for each uterus.
and then
Poor thing, poor
double
thing.
menopause.
Well, you just have two menopauses that you have it at this. Oh, you mean menopause? Oh, yeah.
Yeah.
Well, it's interesting. That's another story. I guess we haven't gotten that. That's the next episode.
Double
Poor,
hot flashes.
poor woman, poor woman. That's all I got to say.
Yeah, having one uterus is enough, right?
Yes. And double hot flashes.
Yeah. Well, thank you all for joining us today, and we've had a good discussion.